There is now a new hotline number for anyone experiencing a mental health crisis. The 3-digit number replaces the 10-digit National Suicide Prevention Lifeline. And joining us to talk more about this is Greg Hansch. He's the Executive Director at the National Alliance on Mental Illness, Texas, or NAMI. Good morning, Greg. Thank you for being with us.
Good morning. Thank you for having me.
The new hotline number, very easy to remember, 988. Tell us what it is set up to do, what the primary goal is. How does it work?
Yeah, this 3-digit number for mental health crisis calls, 988, it connects people to the existing National Suicide Prevention Lifeline system. What this does, it allows anyone experiencing mental health related distress, whether that is suicide, mental health, substance use, or any other kind of distress, to reach out to trained crisis counselors at no charge, 24/7, 365. The counselors provide de-escalation and mental health intervention services by phone or text. And ideally, they coordinate connections to additional services and help within the community.
Why was this change made? Is it simply because the 1-800 number was too much to remember, and in a moment of crisis, you don't have time?
Yeah, the mental health crises have often been dealt with in the criminal justice system. And far too often, we have law enforcement officers who are responding to crises. There's a shame associated with seeking help. And when there's a law enforcement response, people often end up in the criminal justice system, and lives can be lost due to mental health crises that are rooted in the criminal justice system. So this takes a different approach. It roots our response to mental health crises in the healthcare system. It sends a powerful message that mental health is just like any other healthcare struggle, and we should have a public health response due to that.
Let's bring it back home to Texas. Studies show 61% of Texans who needed mental health treatment last year did not receive any. That's according to a Mental Health Texas report. What impact will this new number have on our mental health care system? Will it help?
It will help, but it's important to remember that this is just a first step. And 988 is really more than just a 3-digit number. It's a vision for a mental health crisis continuum of care that includes a number to call, someone to respond in the case of a more serious crisis, and a place to take a person to if they need stabilization services. So we need our state legislator to really step up to the plate here and recognize that despite this exciting development in the mental health care delivery system, we are lagging far behind when it comes to availability of other crisis services, having enough mental health professionals to provide care in the state, and keeping people with mental health issues out of the criminal justice system. We need a bold investment made in the mental health care delivery system in the upcoming legislative session.
Is this happening across the country as well, not just in Texas, or is Texas perhaps in more dire need?
The 988 is a national system. My understanding is mental health care across the country is lagging behind in terms of access to other healthcare services. Texas is behind the curve when you compare where we're at to other states. So it's really time for our state leadership to take further action to address that.
Well, this, as you said, it is a first step, and it is an easy number to remember. The Suicide and Crisis Lifeline. You can call or text 988 for anybody who might be in a moment of crisis or thinking about hurting themselves. Greg Hansch, Executive Director for the National Alliance on Mental Illness, NAMI, Texas. Thank you so much for joining us and giving us a little more insight into this.
Yes, thank you so much for having me.